Sex, Lies, and Trauma, Part 7. Something is wrong with perimenopause. Hello there. This is Dr. Paul Stoller, and the video you are about to watch is based on Sex, Lies, and Trauma, an article I wrote for a peer-reviewed journal. This is Part 7. 50 to 70% of men in marriages or long-term relationships feel more alone in the presence of their partners than without them. By the time the infamous 7-year itch hits, only a small fraction of partners feel like they are still in love by then. These statistics point to a serious problem that is just being ignored. Most divorces, about 80%, are initiated by women and often against their own best interest. This is due to the brain's limbic system being in flight or fight mode, and the expectation their marriages were supposed to be like a Hallmark movie. Most people don't even know who they are, and if you don't know who you are, how are you going to know what is in your best interest? Especially if your hormones are not at optimal physiologic levels. If you don't know there is treatment for perimenopause, which can last for up to a decade, and if you don't know there is a treatment for the genitourinary symptoms of menopause, like vaginal atrophy, painful intercourse, and no interest in your partner, then you don't know about the benefits of hormone replacement therapy, then go ahead and get that divorce. What did Jesus say? My people perish for lack of knowledge. So much fear was generated regarding potential problems with hormone replacement therapy, or HRT, 2 generations of women were robbed of its benefits. And honestly, few physicians even know how to prescribe hormones correctly. HRT can reduce the risk of colon cancer, fractures, and type 2 diabetes, and reduce overall mortality if initiated early in menopause. When estrogen and progesterone are used together, there's a very slight increase in the risk of breast cancer. Normally, the baseline risk is 30 cases per 10,000 women per year, which goes to 38 cases per 10,000 with combined estrogen and progesterone. That is a very small increase in absolute risk, an insignificant increase in risk. So this minuscule increase in risk was blown out of proportion. And as a result, half the population were not getting an intervention that could vastly improve the quality of their lives and perhaps save their marriages. And this was all done over a statistical nothing burger. Why do so many women seek divorces in their 40s and 50s? Perimenopause is nature's cruel slap in the face. Remember, for most of human history, no one lived long enough to go through perimenopause. So essentially, women are on their own to suffer the slings and arrows of massive hormonal fluctuations. It has only been in the last 150 to 200 years that the lifespan of women passed the 40 years of age mark. Again, most women were dead before perimenopause kicked in, except in the last 150 or so years. Now, not everyone has a rough go of perimenopause, but many do. It can shift one's identity, tolerance, and even the timbre of the voice. The marriage is the first to feel it. It changes the way your brain handles stress and connection. The perimenopausal woman may be resentful over anything and everything, cries for no reason and doesn't know who she is, assuming she knew before. Do you know what some women feel during perimenopause? All emotional connections and feelings for anyone and everyone in their life feel like they were wiped out as if they never existed, and the only thing left in its place is a pervasive sense of dysphoria. It is bewildering at best, and few know the depth of despair one can feel in perimenopause, and fewer still are prepared to cope with it. Often the non-prepared resort to self-medication. But perimenopausal women don't have to suffer. They could be using bioidentical hormone replacement, but most don't, which is unfortunate for any long-term relationship they might be in. The emotional, psychological, and physical changes associated with it can create or amplify stress in a marriage or long-term partnership. Again, we are talking about hormones or the lack thereof. These physiologic changes can destroy any interest in their partners. As the estrogen and progesterone crash, communication feels strained, tension builds, causing partners to drift apart, and interest in intimacy vanishes. One's ability to handle bonding and connection dysregulates, and one becomes desperate for peace. But the spouse is often perceived as the problem. I can't tell you how much oxytocin would benefit here. For women going through this difficult transition, I have two suggestions: oxytocin and practice gratitude for your partner, but also for yourself and all of life, and bioidentical estrogen and progesterone as needed. Given that nature never intended to support our bodies past 40, as there was no evolutionary advantage to support the human body past 40, when you are older than 40, it is now our responsibility to fill in the gaps. First and foremost, by the time we are 40, we are malnourished, even if we eat organic. For our soils are depleted and often toxic. I won't even get into the ultra-processed dead foods that are eaten with the American diet. Pesticides are infamous xenoestrogens, but they are also in cosmetics and innocent-looking household products. A comprehensive nutritional and detoxification plan needs to be implemented as soon as possible, such as in the early 30s. Every metabolic syndrome symptom that estrogen was protecting women from getting now comes to the fore with a vengeance: osteoporosis, heart disease, diabetes, and dementia. The thinning skin women get, very noticeable on the forearms, is because of DHT, which is a metabolic product of testosterone. The conversion of testosterone to DHT needs to be blocked. This is the same hormone that makes men's prostates enlarged and causes baldness. Long-term relationships and marriages do not need to end during perimenopause if it was truly understood that hormones are hijacking one's psyche. Ask for support, not space, and don't make big decisions when emotionally dysregulated. Divorce is usually not the answer, but stabilizing one's hormones is, on a foundation of a stellar diet and detoxification regimens. This is the end of Part 7.